Beyond the Diagnosis, and this is podcast number 10. This afternoon we have Tamlyn Wessels with us. Welcome, Tamlyn. So lovely to have you on our podcast series. If we can please start off by just a little bit of a story about you and your diagnosis and a little bit of background, that'd be awesome.
All righty. Thanks, Belinda. So great to be here with you. I'm Tamlyn Wessels. Most people just call me Tammy. And I am a wife and a mom of 3 kids. And in 2022, the very beginning of 2022, I was diagnosed with triple negative breast cancer. It was a stage 2 diagnosis. It hadn't metastasized or anything like that yet, which was great. So we caught it pretty early. And it was definitely a life changer for all of us. So basically what happened is late in 2021, I just did a self-exam and discovered a lump on my right breast. Checked it out for a couple of weeks, tried not to panic, tried not to think, oh my goodness, this is something awful. So I Googled what do you do when you find a lump. And the advice was obviously it could be hormonal, it could just be changes. So just keep checking, which I did. By Christmas, I realized it wasn't going away. And at that stage, I had actually started perimenopause. So, hormones were all over the place anyway. And because it was Christmas, I didn't want to alarm my family. I didn't want to ruin Christmas by this potential bad news. So when I got back to work at the beginning of January, I made an appointment with my gynae, who thankfully was not on leave, and she could see me almost immediately. And she also did an exam. It didn't feel like a tumor, but let's refer you for the mammogram. And because I am a private patient without medical aid, she referred me to the Groote Breast Clinic. That stage, it was still COVID regulations, so my husband couldn't go into the appointment with me. And they obviously had limited ladies that they were seeing, or limited patients. Typical government, you have to sit in a queue and wait to be seen. So it's quite nerve-wracking because you just see all these other women also just waiting around to be seen. Eventually got in to see the doctor. He did a breast exam, immediately referred me for a biopsy. So it was done the same day. Then I saw a different doctor, and he just explained to me, they'll either call me with the results or they'll call me to come back in. So a week after that, they had the result of the biopsy. They phoned me and they said, please, can you come in? Please bring somebody with you. And then you're like, it's got to be bad. Why do they want me to bring somebody? But I still remained hopeful that it wasn't too terrible. So the following week, it was the end of January, my husband went with me to the appointment, and got a diagnosis that it was triple negative. Told that it's the worst kind of breast cancer to have because it's extremely aggressive. But thankfully, we had caught it early. So following that appointment, they already started saying, okay, well, you're going to have to go for chemotherapy. This is going to be the proposed plan for your treatment. The proposed plan was chemotherapy, surgery, radiation, and they pretty much stuck to that. So it was 8 cycles of chemo, 4 of them being the Red Devil, of course. Then after that, a little bit of a break, do the surgery, and I had opted for a lumpectomy because I wanted to save my breasts. And then the radiation to follow up with the all of that treatment to make sure that everything was got. So that started going according to plan. I think I was about 2 cycles into the chemo. I went for radiation so they could put the little magnetic pin into the tumor. Sorry, not for radiation. I went for a scan, and they put the pin in. They measured the tumor. It was already 3 by 3 centimeters at that stage, so it was quite a bit of shrinking that needed to happen. And went for bone scans, heart scan, just to make sure that I was healthy throughout my chemo. Yeah, so it seemed to be going well. I mean, I did throw up a couple of times. I wasn't horribly ill like some people report to be. Thankfully, they tried to schedule my chemo for like a Thursday or Friday, so I wouldn't be too much time off work, because I worked throughout the whole thing. Did lose all the hair, head, eyebrows, which was for me the weirdest thing to see. But even now, if I take off my glasses, I don't have very good eyebrows. But yeah, and kept a smiley face. I was working for a group of pediatricians at the time, and shame one little girl came up to me and asked me in Afrikaans, Tannie, is you all right? So I said, yes, I'm just a little bit sick, but the doctors are looking after me. I'm fine. So it was quite cute, but you could see her mother was like, well, should she ask, should she not ask? But I was fine with it. I was tried to be very open about my cancer diagnosis. I tried to embrace it, which I think I do with a lot of things. I just sort of bull through a china shop kind of thing and just go with it. So got through the treatment okay. Then about a week after my last chemo, that was the 8th of July, I flew out to America to go see my dad, who was dying of prostate cancer, which I found out is the same cancer as breast cancer. And found out that we actually have it in our family. My great-grandfather had prostate cancer, my father had prostate cancer, and of course now I had breast cancer. So a little light went on, like, oh my goodness, my kids are at risk and I didn't even know. So anyway, I did get to see my dad. He was unfortunately in a bad way. He got COVID just before I got there for the visit. So he was wearing a mask for like the first week. So worried that he was going to make me sick. But eventually got him to take his mask off, made him realize I was fine. Everybody else who was visiting was fine. My sister happened to be visiting at the same time, and she had a few COVID symptoms. But we just wanted to embrace the last time that we were going to be able to spend with him. So he was quite poorly, couldn't walk around a lot, try to get us out the house to go and visit and see everything. And then the last week of my visit with him, I got to massage his legs for him and got to spend time with him. And it's like the only time that he kind of opened up about his cancer, about his journey. I think he was afraid to speak to everybody else because they don't understand what you go through. As much as they're experiencing it with you, nobody else can feel what you feel when you're going through cancer, because it's a very personal journey. And yeah, so I cherish those moments with my dad. We didn't have an extremely close relationship. He was a very closed off kind of person, not very affectionate. But yeah, had some good moments with him while I was there. Then flew back to South Africa for my surgery in the middle of August. Yeah, government hospitals are weird. Staff are always super friendly, but you also never know what the heck's going on. So got admitted, got seen by the the team, because again, it's government, so there's always a team of doctors. You've got those who are learning to be surgeons, those who are just learning, and a great team. I must say, I was in good hands. Felt like a bit of a celebrity because they were photographing everything. Had pictures drawn all over me about where they were going to cut. And the prof who was examining me and talking to his team said, I think we have a little bit of a problem because the position of the tumor, because it hadn't gone away completely, but it did shrink quite significantly. And the size of my breasts is going to pose a problem for radiation. So if I still don't want the mastectomy, which I didn't, they're going to try do a Goldilocks procedure. So basically what they do in a Goldilocks is they cut away the breast, they pull up the tissue that's below, and then they, try create you a new breast out of that. They remove your nipples completely and then have to sew them back on again. Risk in that is that they don't work properly. And then in my case, because they were going to reduce the right breast so much through the Goldilocks, they needed to get a plastic surgeon in to reduce the left, which was a first for Groote. So obviously they've got great plastic surgeons and the breast surgeons are great, but this was the first time the two surgeons were going to be in theatre together at the same time to make me look pretty normal. And they did a great job. Nipples work fine, breasts are pretty much the same size, just the right one did shrink a bit more through radiation. Yeah, so the surgery itself went well, looking good. After the doctors were happy that everything did look good and everything was working as it should, no infection, no extra scar tissue or anything to worry about. They scheduled me for 19 sessions of radiation, which is a bit odd to lie there for 15 minutes while they just basically put the sun on you. And as I said, yeah, so the tissue there did shrink a little bit, but, I'm fine. After the radiation, they did just another blood test just to make sure that it really was triple negative, because some of the markers were a little bit unsure in the beginning. Definitely it was triple negative. So they put me on 6 rounds of oral chemotherapy. And luckily with that, I didn't have too many side effects, just really nausea and a bit of indigestion. And now, because of that, I am at the same risk level as any woman my age. So that reduced the risk of
reoccurrence.
Thank you. Completely. So normally with the triple negative, your reoccurrence happens within the first 5 years. So now I'm probably only more at risk after 10 years. So I still only have to go for a mammogram every 2nd year, as any woman would do for her normal screening. So yeah. And I must say that first mammogram after all the surgery, it was horribly painful. I need to go for my next mammogram now in September of this year, and I'm hoping it's a lot better because that scar tissue has gone away completely. The little lumps that were there behind the nipples, they're all gone. I'm good.
That's brilliant. Tam, so thank you so much for sharing your story. And again, you when you speak about your story, you're really brave and so positive. So thank you for that. So this series is all about family and friendships, and so the who stayed, who left, and who couldn't handle it. So the question I want to ask you is, how did this cancer diagnosis impact your friendship and family dynamics?
So with my immediate family, because none of them live immediately with me. My mother actually just moved to KZN at the beginning of my diagnosis. My sister at the time was living in the UK. My dad was living in the US. So I had no immediate family. Even my husband's family, my mom-in-law is living in Port Alfred. My brother-in-law at the time was working and living at a mine in the Congo. So I had no immediate family other than my little family unit. So it was a bit difficult. I mean, normally your family would rally around you and support you in that way. So it was up to my actual little family, my husband and my 3 kids, to be that for me. And I think initially my kids were scared, worried, that mom's going to die. But seeing how I pushed through the treatment, they were fine. They were actually great through it all. My daughter, who was 16 at the time, was like, "Oh, Mom, sometimes I forgot that you had cancer because you're just doing so well." My husband's was a little bit more taken aback because he's had loss in his life from a young age. He had lost his dad. He's lost some very significant people in his life. So he was always worried that something was going to happen. I'd take a turn for the worse. But he just stayed strong. He was there with me through all of my appointments. I think there was maybe 2 or 3 that he couldn't make, and those were more towards the end. But yeah, he wanted to show his support by being there with me. So through the long waiting process at Grooteskier, he was there all the time, made friends with the nurses. I think just to also make it feel lighter for himself. In terms of friendships, I reconnected with a friend from high school who had seen my status update on Facebook. And she was like, immediately she reached out. She said, "What can I do? I'm coming to Cape Town for the 2 Oceans Marathon. I want to see you." So in that way, it was great. And a whole bunch of people just said, "How can we support you? How can we do? What can we do?" And we had a family friend who would, after every session, come through with a meal so that my family wasn't worried about making dinner for us that night. And it was usually enough to last 2 or 3 nights. So there was those kind of things. But yeah, most people were just very supportive. I find a lot of people didn't know what to say. So those who didn't know what to say didn't say anything. And I just said to those people, "Look, you know what, if you're thinking about me, just send me a WhatsApp, say hi." It didn't need to be anything more than that. At my workplace, my employers were very, very, very supportive, gave me all the time I needed to recover from each chemo session. They had bought me a care package. So I had a lot of support. I was one of the lucky people.
And Tam, if you think about some of the stories and some of the people that have gone through this journey, you'll find that some family and friends actually disappear or distance themselves. And then it could leave the cancer patient feeling abandoned. What are your thoughts around that? I know you didn't experience it specifically, but maybe you heard of others that did.
Well, if I think of my dad, he kept it from us for a long time. He never actually outright came out and said, "I have prostate cancer." He just said, "I'm unwell, I'm being treated, there's an issue, but I'm okay." So I think also sometimes people close themselves off through fear. And I think that's the biggest thing, is that people are afraid to say the wrong thing. They're afraid that they can't be supportive enough. They don't know how to be supportive. So I think it's the same as like if you hear about a death in the family, you say, oh, my condolences, or with a cancer diagnosis, you say, I'm so sorry to hear, but then you don't know what to do next. So in many cases, I think maybe it's people withdraw because they don't want to be offensive and they don't want to be too much in your face. They're trying to give you your space for you to deal with it. And also people just carry on with their own lives. People are busy, you know. Life has us busy ordinarily, and then just because I've got cancer doesn't mean your life stops, you know. So I think we also need to look at it from that perspective, you know.
And so, you know, on the flip side, you find that, you know, did it by in any ways make your family, your immediate family unit stronger? Did you bond more? Were you having more? I mean, you spoke about going to see your dad and having that special time. Do you think that brought you guys closer together?
Yeah, I think so. I mean, we're a pretty tight-knit family, just the five of us, because it's always been the five of us here. But definitely, yes. So learning to take time out and say, hey, mom is not coping today. We need to rally together and do the stuff that she normally does, or seeing that I'm trying to do too much and they say to me, Tam, go rest. We've got this. That helped a lot. You know, being a mom, you try and take on the world. But when you're sick, even when you're feeling fine through your cancer journey, your body is fighting all the time. So you need to rest. You need to, I mean, one of the nurses had actually said to me, don't push yourself so hard. It's going to come back at you at the end. And that was great advice. So, you know, that's what we did as a family. We just try to chip in everywhere.
So, and Tam, tell me if, because often it's the individuals that are on the outside trying to be supportive, they don't know how to respond, they don't know what to say, and you know, my advice is always just like be yourself. But from your side, what do you think that you know, anyone else that if their loved one is going through a difficult time, what do you think would be meaningful in terms of support for people that are going through a cancer journey?
I think the easiest thing is just to drop them a message, whether it's WhatsApp, whether it's you know, a funny meme, or just so that they know that they're thought of. Sometimes those encouraging little poems, those kind of things, just they give your day a lift. So if you, I think, don't constantly, you know, badger them, as it were. Don't sort of love bomb them, because that's also too much. But just check in, you know, say, hey, thinking about you, or how are you actually feeling today? Are you doing okay? I was, you know, just worried last time I saw you. Or, you know, for me, as I said, I try to embrace the cancer journey. So initially I was worried about losing all my hair and everything, but when I lost my hair and people said to me, you know, you've got a great shaped head, you know, I was like, oh, I've got a good shaped head. I can rock this baldness thing. You know, small things like that, they make you feel more confident about yourself. So by the time I got to the end of all the treatment and I had that very typical cancer looking face, you know, swollen, bald, whatever, you can see a cancer patient coming from a mile away. But I had embraced it. I was like owning this journey. And that was through people just smiling at me, just saying, hey, how you doing? Or sending me a little message saying, just thinking about you today, you know. So it's the small stuff that keeps you going on a daily basis.
Okay, and then, you know, part of our journey is knowing when to say, I need some time out and setting those boundaries. And I know that often what happens with someone who's going through the cancer journey, that you often feel as though you can't turn people away, but you might be just too tired, or you might be, just having one of those off days, and you just don't feel like as much company. Or I know one of the guys that recently was on our support group, he passed, and one of the things he said to me is, I just feel like I've got this horde of people coming to see me all the time, and I know they mean well, but I just need a break. So what do you think, in terms of boundaries, what do you think they could be doing differently?
Well, as the cancer patient, you kind of need to say, guys, I'm just tired today. I love and appreciate you, but I'm just tired today. Or like for myself, I was nauseous a lot of the time. Smells, everything smelt like sulfur to me. If it was a cigarette or a car fume or bad food or whatever. So those things triggered my nausea as well. And sometimes somebody could just look at me and know I was like, I can't do this right now. But the responsibility lies with the cancer patient to say, I love you, I appreciate you, I just need to rest, I need time out, I will get back to you when I'm good to go. So your family and friends and whoever your support group are just unfortunately need to respect that. They need to trust that you're going to reach out when you're ready. Because sometimes you just need to be introspective for a bit. You need to figure out, how am I really feeling about this diagnosis? How am I really feeling today? And so you got to be honest with yourself. And so you got to be honest with those around you. And if you are, then they're going to trust that you really are going to reach out if you do need help. Because a lot of us say, no, I'm okay, but you're not. So if you're honest, then people can know that when you do need the love, they can give it. And when you just need the time out, you'll come back to them.
So it's the honesty and the authenticity that I'm hearing is really important.
Yep.
Okay, and then final question. You've had an experience in a public hospital where I know that, for example, in Joburg, some of the treatment's not always that great. But and you've dealt with going into hospital as well as going into a chemotherapy treatment room. What would you like from the medical profession? How could they respond to cancer patients that would be more meaningful and more helpful than what they're currently doing now?
Well, it's really the facility itself. Look, Groote is great because it's an academic hospital. They keep it clean. They do a lot to try and make it look pleasant, if I can put it that way. They try to decorate the wards and the clinics and stuff like that. But the hospital is still run down. And I know other government hospitals are not even as well off as Groote. Like you're saying in Joburg, I've seen the news and stuff like that. So government hospitals rely on private investment to improve their facilities. So for people who are in a government hospital to be waiting for treatment because the machinery is broken, or there isn't enough medication, or just sitting in a waiting room where you've got a mixed group of people who some are very poor. I mean, I had to go to government because I just don't have medical aid, but there's some people there who just don't have very much at all. And at Curtis Heath, they try and treat all the patients the same way, but the hospital itself has a smell to it, which I think most hospitals do. But because it's run down, they could do with air fresheners, for instance. There are lots of private places that come in and try and pamper the cancer patients just to try and make them feel better. But not everybody gets a turn. So I don't know. I think if private investment could be more aware of what it looks like and feels like to sit in that hospital for 4 hours while you're waiting to be seen, they might make the experience a bit better. Often there's a tuck shop usually, so they sell food and all that, but it's not nutritious food. So you're supposed to be feeding your body good nutrients, but what's available to you is just more rubbish, stuff that's not going to help you. There's not a lot of information available. While you're sitting there for the 4 hours, you could be reading about your cancer, other kinds of cancer. You could be reading about health options. So I understand there's also limitations to what other people can supply, but just in terms of the waiting, if they could look at that, because you're bored. You sit there and yes, they've got the TV on, but it's whatever SABC channel, and maybe today the TV isn't on, so stuff like that. And in the government hospitals, there's a lot of traffic because there's just so many people coming through there, that I think the private sector doesn't see. The private sector, you've got your appointment, you maybe with 10 other ladies or 10 other people, whereas in the government hospitals, you've got like 30 people waiting to receive treatment on a day, and there's a lot of waiting. As I said, there's a lot of smells, and when you're going through chemo, the smells are it's like being pregnant, everything is just heightened. So yeah, I think just that if they could address that experience, it would be a lot better.
Tam, thank you so much for your time, for sharing your story, for giving some of your insights. I know you're very active on our Living with Cancer support group, and I just want to thank you for that. I know that you understand what it's like to go through this journey, and you're one of the first to always share and support and encourage. So thank you for that. You're looking fantastic. Good luck for your next scan. I'm sure you're going to be absolutely fine. And thank you for taking the time to just allow yourself to be vulnerable enough to share a story so that it could help someone else.
Thank you, Belinda, for the platform. It's really important.
Excellent. Sorry, I'm just going to stop the recording. There we go. Excellent.
Just to let you know, I was diagnosed with Graves' disease in November last year.